Dr. Peter McCullough is an expert in vascular medicine in Dallas, Texas, and a doctor there. He was, of course, one of the first heart doctors to raise questions around the efficacy of COVID vaccines and to question the COVID lockdowns and school closures that became common during that time. And Dr. McCullough, you are now working with the wellness company, and maybe you can tell us a little bit about people hear the phrase long COVID, for instance, a lot. Talk to us about what it is and what's going on with that.
Well, thanks for having me on the program. I'm in practice as an internist and a cardiologist in Dallas, Texas. So I see patients with long COVID every day. What we've learned is both with the infection and with vaccination, the body takes on the spike protein, which is the spine on the surface of the virus, of the coronavirus. The spike protein builds up in tissues and organs, and it causes symptoms. So about 5 to 10% of the U.S. population, it's estimated, has residual symptoms. We call post-acute sequelae after the infection, or we call it a vaccine syndrome. Since most people who took the vaccines got COVID anyway, they've actually had both exposures. And the common features are loss of mental clarity or brain fog, post-exertional malaise, heart pounding and palpitations, numbness and tingling. And we've learned that there are some methods by which we can actually help the body clear the spike protein and resolve the syndrome.
So this is long COVID, and you're talking about some of the symptoms, saying that numbness and heart palpitations. Am I hearing you correctly?
That's right. So there's cardiovascular, neurologic. Importantly, there can be blood clots or thrombotic, and there's actually autoimmune manifestations that are picked up on blood testing. The autoimmune manifestations involve skin rashes and joint pain.
What do you recommend, for instance, to treat long COVID? Is there a treatment? Is it treatable?
We've published 2 peer-reviewed papers on this topic. I'm the first author. And the protocol is called McCullough Protocol Base Spike Detoxification. It's been copyrighted in my name so people can locate it. But it's the combined use of 3 over-the-counter oral supplements, nattokinase, bromelain, and curcumin. These are natural products that have been shown in preclinical studies to dissolve the spike protein, aid the body in clearing it, and then block some of the inflammation that happens in the body from the spike protein. So this triple combination is featured in the Wellness Company product called the Ultimate Spike Detox. You can buy the product separately online or in natural stores. And then we commonly add other drugs to it depending on the syndrome. So if there are craniofacial features or skin rash or pulmonary symptoms, I saw a patient like that. We use ivermectin over the course of about 90 days. If there are chest symptoms and subclinical, what's called myopericarditis, colchicine, another prescription drug that was used extensively during acute COVID phase of the pandemic. Colchicine is indicated for a year. Believe it or not, for the numbness and tingling, loss of mental clarity, we use a topical nicotine patch. Low-dose nicotine patch at 7 milligrams a day. The nicotine interferes with the spike protein as it is damaging the acetylcholine receptors in the body. And lastly, if there's autoimmune features, a positive blood ANA, rheumatoid factor, anti-citrulated peptide, we use hydroxychloroquine. So that's our armamentarium of managing long COVID syndrome. It takes probably a year or more for most patients to be restored to normal in my practice experience.
Fascinating. Sir, I know that some of your colleagues, your fellow doctors, Peter Hotez, I think he's one of the most notorious people from the COVID pandemic. He was recently on MSNBC saying the U.S. could be hit by multiple pandemics after Trump is inaugurated. How real is that threat, do you think, sir?
The question is, how does he know? How would one know that a pandemic would hit on January 21st? And I think that's the first question Americans asked is, why would an expert come on and say that a pandemic, that presumably would arise from nature, would actually arrive, the day after inauguration? And I think reading between the lines, what he's saying is that there are so many biolabs, there are so many labs doing gain-of-function research with so many different pathogens, viruses, fungi, bacteria, that in fact a lab leak or release could actually occur under Trump's watch and have an outbreak, get people sick. And I think it's just the most dastardly type of thought one could actually have as an expert. And I can tell you, as a treating doctor, we have become quite agile in treating almost any threat that can come our way. It's always about early treatment. Vaccines are never a solution for pandemics.
Talking about early treatment, what do you suppose people can do to be prepared for what might happen? Should the Trump administration be making preparations as well for what might be coming, sir?
First off, most of the pathogens of concern are respiratory viruses. Everybody should have a good oral and nasal hygiene program. The simplest would just be a saline nasal spray and a simple gargle, scope, or Listerine. The nasal sprays can be upgraded to xylitol-based sprays, which would be Clear or Cofix RX, or iodine-based nasal sprays like betadine or Immune Mist. Nasal sprays and gargles twice a day in the prospective double-blind randomized placebo-controlled trials are very effective, actually far more effective than a vaccine, in cutting down the risks of getting COVID-19 or influenza. And then at the wellness company, we offer emergency kits. People can actually get pre-prescribed kits that have an armamentarium of medications guided by a doctor on hand. We know with all of these threats, treating on day one is key, not waiting 2 to 4 weeks into the illness and being hospitalized like what happened with COVID.
Are these kits portable, perhaps? Can you take them with you, for instance, if you're traveling?
They are. They're small. They're portable. They even float in water. There is a heavier base kit that people can keep at home, which has almost everything in it possible. But it covers a range of bacterial infections from Mycobacterium avium intracellulare, Mycoplasma. These are far less expensive than a single trip to the urgent care or emergency department.
And what are they called again? What do you call it?
They're called emergency kits. Go to the wellness company, emergency kits. You'll see a whole array of them.
The wellness company, emergency kits. There's also a link, twc.health/OAN, twc.health/OAN, and the promo code to save 10% is OAN, promo code OAN. Dr. McCullough, it's been a pleasure catching up with you. Last time I saw you was at a forum with Senator Ron Johnson in the Russell Senate caucus room talking about COVID. And you were very well informed at that time and as well today. Thank you very much for talking to us. We appreciate your time.